Good Thursday afternoon. I'm Charity Menifee, Director of Communicable and Environmental Disease and Emergency Preparedness here at Knox County Health Department. Our moment of gratitude today is dedicated to our community partners for working with us to continue to reach out to minority and vulnerable populations in our community to get them vaccinated. We will continue, and we want this to be a priority for us to work to provide information and education to everyone in our community so that they can make informed decisions about the vaccine. This includes a particular focus on our minority communities, including those in our Hispanic and African American communities, our refugee communities, and those with disabilities, among others. We want to thank Dr. Keith Gray, who was just here on Tuesday and talking about some of these efforts for these important efforts as well, and many others that are contributing to these efforts overall. For a vaccination update, as of this morning, KCHD has administered more than 4,200 doses of COVID-19 vaccine. We have an additional 5,000 doses that we've received and are scheduled to be administered at several vaccination opportunities in the near future. 975 of those doses will be administered at this Friday's clinic with pre-scheduled appointments. Those are already full. And a significant portion of the remaining vaccine are scheduled for second doses for those who have already been vaccinated at KCHD. We've received another shipment of vaccine today. Those doses will be used for a vaccination opportunity on Saturday. Qualifying individuals will be able to sign up for appointments on our website beginning tomorrow at 11 a.m. We will get information out first thing tomorrow morning through every avenue we have, our website, social media, media advisories, everything that we can use to push out information on how those without internet access can sign up tomorrow morning, again, beginning at 11 a.m. As well. As a reminder, the numbers we just reported out includes those doses that KCHD has received and administered. It does not account for the thousands of doses that are being administered by our hospitals and other corporate pharmacies as a part of their federal partnership with long-term care facilities. We continue to vaccinate in the first priority groups. We're ready to show those, including healthcare workers, first responders, and those 75 and older. The full list is up on our website right now. So you can go to our vaccine information page at any time and see who are in those groups. But the overarching groups are healthcare workers, first responders, and those 75 years and older. Looking at the statewide numbers for vaccination, as of Tuesday, Knox County is doing very well with administering vaccines to its population. More than 14,000 people in our community have received their first dose, and approximately 11,000 are fully vaccinated. Knox County is actually the fourth leading county in the state for administering second doses, and this is encouraging and something that we will continue to build upon. Hospitals have also begun creating their vaccination opportunities for qualifying individuals, so be on the lookout for those opportunities as well. Those, like ours, are likely to fill up very quickly due to the demand outpacing the supply. As we've mentioned, while KCHD and hospitals are the primary vaccination hubs right now, that won't be the case in the future. As more vaccine comes to our community, there will be more places to receive it, such as pharmacies and your provider's office. And we are eagerly looking forward to that day, as that will help increase access for many in our community. And now moving on to our local situation. We have 196 new confirmed cases of COVID-19 since yesterday's report, 3,570 active cases, 135 Knox County residents are currently hospitalized, and sadly, we have 11 additional deaths to report today, raising our total to 434. Now we'll turn to the benchmarks. All of this data that we're going to talk about is on our website. You can find it at covid.knoxcountytn.gov/case-count. Moving to the first benchmark, sustained reduction or stability in new cases for 14 days. Over this time period, we saw daily new cases drop to approximately 264 cases per day. That's down from the previous reporting period, which was more than 300 cases a day. We are optimistic about these numbers, but we are continuing to keep a close eye on them We do hope to continue to see this trend moving in the direction that it's moving. Because of this, we are representing this benchmark as yellow. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test result reporting turnaround time. Regarding testing, over this time period, we saw testing drop to just over 9,000 tests per week, which is down from the more than 10,000 tests over the previous time period. This is something we are keeping a very close eye on. We continue to urge those with symptoms or who have been exposed to COVID-19 to get tested. We want folks to continue to get tested. Regarding lab turnaround time, this number has continued to decrease and now sits in an average of 2.1 days for the community. That's a good thing. Because of these concerns about lower testing numbers, coupled with the positive news regarding a shorter lab turnaround time, we are representing this benchmark as a cautious yellow. Our third benchmark, sustained or increased public health capability. Based on our internal assessment of our capabilities and acknowledging the continued need to prioritize our case investigations and eliminate our contact tracing in order to support additional response operations, we are representing this benchmark as red. As we say every week, we want to remind everyone to take personal responsibility and quarantine at the first sign of exposure. Isolate yourself if you have symptoms or if you've been exposed, and start calling your close contacts to make them aware so they can begin quarantining. Additionally, if you've been tested, regardless of whether or not you have symptoms, you need to quarantine until you get your results. Our fourth benchmark, healthcare systems capabilities remain within current and forecasted surge capacity. During this time, there were flags detected for all categories. However, the downward trend we spoke about last week has continued this week. This is encouraging as well and something we hope to see continue. After speaking with our hospital partners, they have recommended that this benchmark be represented as red. We want to reiterate what Dr. Keith Gray said on Tuesday, that we caution you against normalcy bias. While these numbers are better than they have been, our hospitals are still at high capacity levels. So we don't want a high number that is still challenging for the community, challenging for the hospitals to become normalized. So we want to make sure that people understand that. We will continue to keep our eyes on this benchmark and hope to continue to see it trend downwards. As always, the hospital systems continue to meet routinely, work together to ensure that no system is impacted disproportionately, and plan the response together to best serve this community. The decisions regarding on how to classify this benchmark are made in concert with our hospital partners, as well as taking all of the data into consideration. Our fifth benchmark, sustained or decreased COVID-19 related death rate for our identified positive or probable cases. For this benchmark, we use a graph that shows the reported deaths of Knox County residents by date of death. During this time period, we have seen 65 deaths associated with COVID-19. Which is up from what we reported last week. And because of this information, we are representing this benchmark as red. Under our supplemental data section, the first chart shows new daily COVID cases per 100,000 population. As of Wednesday, our 14-day trend line shows 55 new cases per 100,000, and our 7-day trend line shows 42 new cases per 100,000, which is down from last week and again shows the downward trend we're seeing. The second chart shows the percent positive for COVID-19. This data is received from the Tennessee Department of Health, and the 7-day average for percent positive in Knox County is 18.13%, which is down from last week as well. And I'll now open it up for questions.
All right, as a reminder, media members in the Zoom chat can go ahead and submit their questions. First question we have is from Brian Hornback. Does KCHD have the ability to see what other counties/cities in Tennessee are receiving in vaccines? And can you see what other states and cities are receiving in vaccines?
We do not. So the view that we have is the view on the statewide dashboard that everybody can see. That's as far as it goes at this time.
Another question from Brian Hornback. Knox County Sheriff Tom Spangler in a press conference this morning said that there is not a mask mandate, but a mask recommendation in Knox County. Is that accurate?
I actually believe that there is a mass regulation in Knox County at this time that was put forth by the Board of Health.
From Cole with WBIR, I may have missed it. How many appointments will be available tomorrow at 11 o'clock?
975.
And he asks, and this is for a pod on Saturday at KCHD. Will people be able to sign up via the KCHD website?
The opportunity will become open tomorrow at 11 a.m. for people to sign up on the website. And then again, like I said in the opening statements, we'll put out first thing in the morning how people that cannot access through the internet can register as well. And that will be open at 11 a.m. also.
From Jeff with WATE, of the 5,000 new doses, how many will be unclaimed after the Friday event and the second doses?
I don't have that exact number. There shouldn't be any, but obviously there's sometimes that folks don't show up. But we also have situations where people sometimes got a first dose in another area and are needing to get their second dose here. So those doses should be used up for those situations as well. The clinic on Saturday, just to be clear, will not be held at KCHD. Again, all of that information for Saturday's clinic will be released in full detail tomorrow. We heard you and heard that people wanted advance notice of when registration was going to be open, and that's what we're providing today.
And just to echo what Charity said, we'll provide more advance notice tomorrow morning too when we send out more information in a news release ahead of that 11 a.m. Announcement on the website. Let's see, from Cole with WBIR. I know there are variables, but best guess, how long do you expect Knox County to be before Knox County has vaccinated enough people in the current phases to be ready to move into the next phase?
We really have to look at the population numbers, and that's really challenging, and seeing what our uptake is as we get more vaccine into the community. But it's probably going to be a little while. We're a large county, and we have a lot of folks that are in those first priority groups that, we have over 31,000 people that are over 75, plus all the healthcare workers and first responders. It's a lot of people. So when you look at what's been received, we're still working through those. So I can't give you, I don't have the magic ball to tell you the exact time frame, but it's still going to be a little bit of time.
Also from Cole with WBIR, Tuesday you said there are 30,000 people over 75 in Knox County. Does that include residents of long-term care facilities? And if so, do you know what the breakdown is between general population that you have to vaccinate versus the federal programs that CVS or Walgreens are doing in long-term care facilities?
We don't actually have that breakdown via long-term care or people that aren't in long-term care. I can say that number is based on census data, and those are Knox County residents. So it would be no matter where they live, they're in that 31,000 number.
From Vincent with Knox News, you mentioned private providers. Do you know which ones are currently distributing vaccine?
There's not any right now. The mention of this was that we are looking forward to the day when it's in the private providers' hands. But right now, it's public health, hospitals, and those private pharmacies that are the pharmacies that have the federal contracts to help with long-term care.
From Allie with Knox News, have operators been added to the COVID-19 information line? If so, how many, and is it helping control call volume?
Yes, I don't work with that team directly, so I don't have the exact numbers, but I do know we've added them, and I think call volume is getting better. But just know that every time we make these announcements, the call volume goes through the roof across the board. And so there's probably going to be waits again tomorrow, and we will continue to work through that process as best we can. We ask people to please be patient.
From Cole with WBIR, how much heads up does KCHD get before shipments of vaccine arrive, and are the shipments standard amounts?
The shipments, Dr. B is going to answer that one. Go ahead.
Okay. So the shipments at this time are not in standard amounts. I've explained this before. The federal government releases doses to the state. The state looks across the state and divides that out based on population and some other factors. So it is not standardized yet. And we get information from the state about the total number of doses coming to Knox County, usually at the end of the week or over the weekend or sometime like that. And then it's divided among the hospitals and the health department. And then we get notice that it's on its way, kind of like you get notice that you're getting a delivery from Amazon or something. We get notice that it's on its way, usually sometime during the week before it gets here. and then it's been arriving Wednesday or Thursday, pretty consistently on Thursday.
And yeah, we feel good about things when we get that notification of shipment, because that means it's literally moving here and is not being diverted somewhere else.
From Jeff with WATE, do you know of any specific explanation for the spike in deaths going from 2 deaths on Tuesday to 14 on Wednesday, or for the increase in deaths from recent week to the week before?
Yeah, I think what we're seeing, always to encourage people to look at trends over time, not one day to the next. That's always challenging, and there can be so many variables there. But we have seen an increase over the past couple of weeks. I think this is truly, and we've talked about this time frame a lot, I think this is from the spike that we saw in December of cases. It tends to take 10 days to about 2 weeks for those hospitalizations to hit following a case spike, and then another week or more for the deaths to start showing up. So we feel like this is probably due to that. And we'll continue to look at it, which, we're hoping that we see this drop back off, as well as our case numbers and our hospitalizations are dropping off as well.
All right, a couple questions here from Cole and Charity. I'll read them all out because it might help you answer the questions here, but then I can repeat them as needed.
Thank you.
Cole with WBIR asks, is KCHD getting to a point where the doses it receives from now on must be allocated for second doses? Are you expecting to see the number of first doses to go down or level out because of the second dose requirement? And then how is that communicated or allocated from TDH to KCHD?
Okay, so right now we are getting vaccine, and Dr. B can chime in if I say anything wrong or needs to add any clarity to what I'm saying here. So we are still getting separate allocations of first and second doses from Tennessee Department of Health. And so what we are talking about today, just like we said, so we have 975 doses Friday that we received that were allocated for first doses, and then the other batch were for our second doses that are coming due next week. That's the plan that we're continuing to move forward with. Everything's subject to change, and we'll roll with it as we always do if it does. But right now, yes, it's 2 separate allocations that are coming to us, and we plan accordingly based on those allocations.
From Vincent with Knox News, to clarify, KCHD and local hospitals are both providing vaccines by appointment to the public?
Yes.
Yes. And just need to look at those opportunities from the hospitals. And again, we'll be announcing our next round, or opening up our next round tomorrow at 11.
And we just want to stress there too, that the hospitals, as Dr. Gray mentioned on Tuesday, they are also following those priority phases too. So it's not just to the general public. It is still in line with the statewide plan.
Yes.
Allie with Knox News asks, what community partners are helping KCHD connect with minority groups?
There's a lot. We are working with the Faith Leaders Group. I believe Dr. Gray mentioned that group Tuesday. We are working with Centro Hispano. We are working with CAC. I'm probably leaving out some, but those are some of the big players at the table. Any way that we can help get information into the community to make them have all the information and data they need to be able to make decisions based on the vaccine is really what we want to encourage across the board, and our partners are really working hard on as well.
Any further questions, please go ahead and submit them now. All right, Cole asks for a second, so it looks like he's typing, so we'll hold off for now.
I might not have answered his question fully before.
All right, in the meantime, while Cole's typing, if anyone else has any questions, please go ahead and submit them. Jeff with WATE asks, do you have any update on the vandalism at KCHD?
I do not have any update at this time.
All right, well, we'll continue to wait for Cole. If there's anyone else that has a question, please go ahead and submit it now. Oh, Cole says he realized that you actually answered his question, so he says thank you.
Yay.
Brian Hornback asks, is the same suspect arrested for vandalizing the mayor's house the same who's suspected of vandalizing KCHD?
With that, yeah, I would ask law enforcement on that. We haven't received an update on that.
Okay. And last call, any other questions? All right, not seeing any come in, so thank you all for your time, and we will do another media briefing as always on Tuesday at 12:30, and you can be on the lookout for a news release tomorrow morning with more information on available opportunities for Saturday. Have a good and safe rest of your day.